Hello and welcome to this video. My name's Kris, I'm an Australian GP, and today I'm going to be talking to you about yet another very common condition, reflux. More specifically, gastroesophageal reflux disease, also known as GORD. You may have seen it written as GERD before. In Australia, we write esophagus as O-E, esophagus, not E-esophagus. So G-O-R-D, GORD. From here on, I'm either going to call it GORD or reflux because its full name is too long. So if you're interested, please keep watching. So GORD itself is not just one condition. It's actually an umbrella term for a whole host of conditions wherein there is a refluxing or how do you describe that? Stomach fluids coming up back into the esophagus and sometimes into the throat or the mouth itself, and sometimes even the nasal passages, which is classified as abnormal. So why does it happen? So let's talk about why it doesn't happen in the vast majority. And mind you, I'm talking about reflux in adults. Reflux in kids, particularly neonates, is a completely different topic because there's a whole host of different physiology and anatomy to talk about. But in adults, what we've got the mouth, we've got the esophagus. At the very bottom of our esophagus, sort of sits around the middle of the chest there, is the entrance into the stomach. In between the pipe and the stomach, which I guess is kind of like a bag, there is something called the lower esophageal sphincter. This sphincter is a smooth muscle and it remains closed, basically as a one-way valve. So when you swallow, things go through it, but it closes up so things shouldn't come back up. For a whole host of reasons, this may fail. So some of the reasons being hormones from pregnancy. This is why reflux is a really, really common sucky side effect of being pregnant. Sometimes it's because you've got increased intra-abdominal pressure, which can come from, again, pregnancy, baby, but it can also come from being slightly overweight or morbidly overweight, anything on the spectrum there. Can come from having organs that are larger than they should be. It can come because of a small defect in the diaphragm, which is a connective tissue that separates the chest from the abdomen, wherein some of the stomach actually comes up into the chest cavity itself instead of remaining in the abdominal cavity, which can cause a dysregulation, it might be the term, or a failing of the lower esophageal sphincter at times. So things just kind of wash back up instead. A really common cause of the failure of the sphincter can also be smoking and alcohol, and these also contribute to the acidity of the stomach and the contents of the gastric juices, so it can cause more symptoms than anything. Two other things that also increase your risk of having reflux include long-term non-steroidal anti-inflammatory use and caffeine. There are lots of triggers for reflux though, mind you, so just because I didn't list it doesn't mean it's not a trigger. A lot of people find certain foods, spicy foods, tomato-based foods, even sometimes dairy, which is interesting because for some people drinking milk actually helps their reflux, but for some it causes it. It's not fair. Basically lots of things can trigger reflux, but usually it's a failure of the lower esophageal sphincter for one reason or another, and the refluxing, because there's no other better term for it, of the contents of the stomach into the esophagus and sometimes as far up as the mouth or the nasal passages. So what might you feel if you've got reflux? Well, there is sometimes a burning sensation, and this makes sense. The stomach has an insulation of sorts to cope with the acidity of the stomach contents and the fact, the gastric juices there are really acidic to break down food and help with digestion. The esophagus doesn't. So if that acid comes up into a less insulated area, then there may be some burning. Some people actually get pain as well, either in their chest or in their sort of upper stomach area here. Some may get some bloating, some may burp more. Some people get a really bad water brush, acidic, kind of yucky taste in their mouth. That's a really common thing I hear. For some people it's a dry cough, because if you reflux into the pharynx or the area where the vocal cords and such are, then it's really irritating. Again, that's definitely not insulated against it. So you get that real dry cough, or when you lie down flat, you might start coughing. This can lead to a cough overnight. For some people, it can just be vocal changes to their voice. There are lots of symptoms. As physicians, we're usually pretty good at taking a really good history and figuring out if someone has reflux based on that. As you can tell, there are some really well-defined symptoms and causes that we can usually link together without the need for any blood tests, scans, or anything. However, it is not a perfect science, just taking a history and examining you and ruling out other things. So sometimes we will do things like ordering a chest x-ray to see if you have a massive hernia or if there's something else in the chest that's causing your symptoms. We may order blood tests to see if there is anything biochemically that could be driving it, or that could be causing your pains instead. However, to really define reflux, there is a test called a barium swallow test, wherein you, as the patient, swallow barium, as the name suggests, which is a solution that we can see on x-ray and in scan. So when you swallow it, we see how it travels, see if there's any thinning of the surface area of the esophagus or the diameter, see if there's anything blocking it, see if it enters the stomach, and then if it refluxes back up or not. So it's a really definitive test. The other thing we can do is endoscopy, which is camera down the throat to look in the esophagus and the stomach to see the presence of reflux, yes, but also to see the effects of it. Are there ulcerations because of it? Is it actually affecting your esophagus? Is there something else there that's causing the same symptoms? So there's a lot of things we can do. All right, let's say you've got reflux. What do you do now? Well, we talked about a lot of the risk factors before. Caffeine, being overweight, non-steroidal anti-inflammatories, some prescription stuff too, don't get me wrong, pregnancy, lots of things. So you can do some lifestyle modification and reduce whatever risk factors you can. For example, reflux often resolves after a pregnancy is resolved, so you could wait for that. Someone might want to cut down on their smoking and alcohol, and that might be enough. Might start losing some weight. But in terms of medications, there are medications that can reduce the acidity. So these are usually the antacids. Sometimes we use antihistamines because the acidity of the gastric contents is because of the histamine component of it, which are a positive ion, which we're not going to go into like all the nitty-gritty science, but antihistamines like ranitidine can be used to reduce the acidity. And sometimes we use a proton pump inhibitor, or a PPI, to reduce how much the proton pumps, which positive proton histamines kind of all linked together, is produced by the stomach lining itself. Obviously, we don't like to just band-aid and just say, here, take this and you'll be good forever. We do like to try and reduce the reflux in other ways too. So some of the advice you might be given is not eating too large a meal, so eating small, frequent meals, not eating too close to bed, so giving yourself time to digest before you lie down flat, sleeping with an extra pillow or on a slight incline if the only time your reflux symptoms occur is when you lie down flat. And general things like good movement, reducing stress, etc., which sounds so easy, and I know it's not. So there you go, guys. That is gastric esophageal reflux disease, GORD, or reflux in a nutshell. If you have any questions, let me know. If you have any topics you want me to cover, let me know. But until next time, stay safe, stay healthy, and I'll see you in a video very soon. Bye.